Welcome, Teresa. This is Dr. Teresa Alasio. Welcome to the podcast. I'm so excited that you're here today. We actually met on a separate call. And when I learned a little bit about what you were doing, what you were up to, and your background as a medical doctor, I was quite intrigued. So, welcome. I'm so glad you're here.
Oh, thanks, Rhonda. I am thrilled to be here today with you.
We are going to chat about a topic that has been near and dear to my heart, and that is lichen sclerosis. And many of you listening you may have heard of it, you may not even know what it is. But before I kind of dive in and give my 2 cents on that, Dr. Alasio, would you please give us a little bit background on who you are so that our listeners can have some context about why you're very qualified to talk about this topic?
Sure. So thanks, Rhonda. So I am a medical doctor. My specialty training is in pathology and laboratory medicine, and I've been practicing anatomic pathology for over 15 years in northeastern United States, in Connecticut and New York. I specialize in cytology. I also read dozens of biopsies, including GI and GYN specimens. And in the past, I would say year and a half, I have actually been transitioning to practice functional medicine which is I've come to see the light, honestly. It has completely captivated me. It has completely transformed me in so many ways. And I feel like my background in diagnostic medicine has been revived and enhanced, and all of the tests that can be done in functional medicine is a world that I had no idea existed. So I got super excited, super excited.
I love it. I just love it. I feel like I always say you've come over from the dark side, and I mean no disrespect about that at all. But like,
It's
if we think about
it's
like
true.
what Western medicine is really kind of the dark ages to some degree. It is. It's not
True.
open. Yeah. Go ahead.
It's not open, and rather than poo-poo, pardon the pun,
Yeah.
of Western medicine, I would say that the functional perspective makes so much more sense.
Yes, it does.
Looking for root causes, looking for the links between, if you're inflamed in one area, you're probably inflamed in another area, and all that inflammation is linked.
Yeah.
Why is it so hard to make that connection?
Right. Yeah.
And
agree.
I think it's just brilliant. I am amazed at the work that all these different practitioners that I come in contact with, and people who are thought leaders in this field, have taught me so much. I feel like I'm going through a renaissance.
It is
In a way.
It feels like that, doesn't it? Because it's like a closet door opened and you realize there's just a whole nother world in there that you know nothing about. And I will say, I want to jump in here and say, the podcast I did recently was on why I hate functional medicine. And so for those of you listening, and so Teresa, I want to qualify. For those of you listening that have listened to that podcast, I don't want you to think I fell off the turnip truck and I'm reneging. What I don't like, and I will say this, what I don't like about many, not all, but many who use the functional medicine term is that it seems to still fall or swing over more towards that medical side. We're going to just test and test and test and test and test, and we're going to just go, okay, and we're going to symptom chase based on the tests. And it talks about using that, featuring or looking for that underlying cause, but sometimes it still is a little too medical. So I like to think about functional medicine as more of like a functional wellness. We're leaning towards that, using the functional approach and taking advantage of what we have available because of all the testing and the clinical diagnostics that we can do. But we want to swing that more really towards, so functional medicine, I think in my mind, I'm thinking it's really more like functional wellness. We're really trying to restore wellness and health, optimal health to the patient using a more functional diagnostic approach. So
Yeah,
that's
absolutely.
my 2 cent caveat. So that was only because this was a recent podcast and I had so much positive feedback about it. I didn't want all you listeners to go, wait, is she reneging? No, I'm not reneging. So
No, I mean, from my perspective, though, I see it as, after studying disease and coming from a place of disease, right? Because pathology is, we're looking for disease all the time, right? It's very disease oriented, and even medical training It's all about like waiting till the patient comes to you and they're sick.
Yeah,
Well,
exactly.
what about the patient who is well? What else is it's what about making them well instead of making them sicker or treating all
Yes.
different kinds of things. So, but my point with all this is that looking at disease like lichen sclerosis, for example, which we're going to talk about in a few minutes. You see it from one perspective, and then when you twist it on its head, so to speak, and you look at it from a functional perspective, it has a whole different it's a whole different prism.
It's like looking in the windows of a house. I always say, if you look in the front windows on the either side of the front door, you're only going to get that perspective. If you look at through the side windows, you're going to get a different perspective. Same house. If you look in the backyard and through the back windows, you're going to have a completely different perspective of the house. It's when we look at all those different perspectives that we get to see, what does the floor plan look like? What is the architecture of this condition? How is it expressing itself? What rooms are connected? And what other conditions are connected? We have lichen sclerosis. That's just one thing, but what else is all in the house, right? That's just one room in the house. So you're absolutely right. I completely agree.
Exactly.
Yeah.
So, I mean, if you take a condition like lichen sclerosis, which is part of this category of inflammatory dermatoses of the female genital tract, and also men can get it too.
Mhm.
So it's not just exclusively female, but it is found most likely in postmenopausal women.
Right.
And this is a condition that is rarely talked about. It
Yes.
doesn't get a lot of light because women don't want to talk about it. They don't want to bring it to their doctor. They don't feel comfortable. They would just rather they suffer in silence and they don't get it addressed. And and it's a shame because and I think it's because it's underreported, we don't know what really the prevalence is. And I've read it from all
Yeah.
over. The literature reports
Yeah.
different prevalence. I mean, depending on where you look, it's like 1 in 100, 1 in 500, or then there's some place that say, oh, it's very rare. It's like, for me, I mean, having read biopsies throughout the years of GYNs who take biopsies of these patients, I think it's actually a lot more common.
I do too. I do too. I think we could be looking at, I read one report or a study out of in 2020, and they reported a 1 in 70 prevalence. And I thought that's still way too high. My guess is I'd probably put it around 1 in 20, maybe even less than that. It's extremely common. And in those postmenopausal women, they go to their gyne and the gyne either isn't educated about it or misdiagnoses it as just being dry labia, vulvar changes that start to happen as a result of the decrease in estradiol, hormonal switches,
Right.
and she's just dry and there's some itching and the tissue gets a little damaged and they're like, yeah, totally normal, when really it is somewhat of a degenerative disease to that local tissue and it goes underreported. So more people have it and it goes underreported, which is like a double-edged sword.
Well, unless you get plans who are the knowledgeable type who do biopsy it. There are a fair amount of GYNs that will say, okay, well, let's take a piece and see what's going on. And it lichen sclerosis is also when the differential is something like lichen planus
Right.
and other lichenoid type of conditions, but specifically lichen sclerosis, it can strictures,
Yes.
urethral strictures.
Yep.
It can affect the perirectal area. It does also cause adhesions, like clitoral adhesions, which this can be a devastating condition for many women who are
Right.
affected by it.
Yeah.
It does not cause any lesions in the vagina or in the mucosal area. So that's what differentiates it from a condition like lichen planus, which can
Right.
affect the mucosa,
Right.
including the oral
Oral.
mucosa,
Mm-hmm.
right? But you do want to investigate and diagnose because of the implications. There is a small but significant association with aplasia
Yes.
and squamous cell carcinoma in a small but significant percentage of women. So you want to catch it, you want to treat it and control it.
I'm going to jump in right there because I think that's a
Yeah.
really good point. I want to make sure we highlight that. And that is that The conventional treatment for lichens, I know that in some of the groups that they did some control groups. They found that in the control versus the women that had the lichens, that when they treated it with the topical steroid titrated down over 3 months, that those women were far less likely, if at all, to end up with that squamous cell dysfunction or cancer, neoplasia. Whereas if you get it early and you can get that treatment there. Now, I'm not a big fan of using steroids, topical steroids, because they're harsh, they're hard, but it does get it under control quickly. While then we can come in and do some of the functional wellness, functional medicine. We can come in and do some of the restorative and repair while you're quieting down the symptoms. I always think of it, it's not the same, but I think when you have a wicked headache and you know you need to go to the chiropractor, you got to function. So sometimes 2 ibuprofen is just the way we roll. And we're going to take 2
Exactly.
ibuprofen and I'm going to shut this thing up because I can't get to the chiropractor till tomorrow, but I have to function in my life. So for a
Exactly.
woman that has lichens, sometimes that topical intervention allows her to function. And then hopefully she's working with a functional medicine, someone in this realm that can help deal with the underlying cause, look at the link to autoimmunity, right? Deal with the topical issues and use herbs like gotu kola or PMGs or whatever. So anyway, I
Well, I
wanted to
mean,
jump in on that.
especially since when you talk about functioning, I mean, this is really something that can be debilitating
Oh,
in daily
yes.
life. I mean, one of the main symptoms of LS is itching.
Yep.
So just general itching, painful urination. These, how can you go to work?
Right.
Honestly, if you're
Right.
not working from home. But even if you are working from home, who wants to be itching all day?
All the
This is
time. Yeah.
terrible.
Yeah. It's
You can't
terrible.
live with that. And you shouldn't have to live with that.
Yeah.
Right. So
Yeah.
I agree. Yes, it can be a bicameral approach to control those symptoms, but also look at the underlying cause, which is the
Yes.
inflammation and the autoimmune. And so when we talk about the autoimmune link with sclerosis, there is evidence in the literature. There have been some studies to link lichen sclerosis with an autoimmune etiology
Yep.
associated with autoimmune diseases. The most commonly is with thyroid.
Yes. Yep.
Also, type 1 diabetes are both associated or can occur with lichen sclerosis. Lichen sclerosis, since it is mostly a postmenopausal woman's condition, you should be looking at the thyroid as well. The
Anyway.
type 1
Yeah.
anyway. I
Yeah.
mean, you have to be looking at the thyroid and alopecia as well.
Yes. We know then that if there's an autoimmune going on, that we know that autoimmune, so much of that autoimmune trigger, shall we say, or it's always which comes first, the chicken or the egg?
Yeah.
Is the lichens first and that, or is it related because we had like a Hashimoto's and then we develop lichens? But we know when you have one autoimmune, you are a sitting duck to have multiple. Because when you
For sure.
you get that dysregulation in the immune system, if you have one, it's just a matter of time before the second, the third, the fourth, the fifth. So once those dominoes start to go, then we have to stop and say, well, wait a minute, how do we look at what's underneath this? And that's where for me anyway, the very first place that I'm going to go is the gut. That's the first place I'm going to look for.
For sure.
When you have an autoimmune. Would you agree with that?
I would agree 110% with that. I mean, when you think that 80 to 90% of your immune system is in the gut,
Yes, that's right.
right? That's the place you have to go. That's where you have to go to look for any kind of autoimmune dysfunction. And, now with the thinking of the rise of I guess, I don't know, the power of the gut microbiome,
Yeah.
this whole it's practically this rediscovery of the gut thing. Everything comes from the gut.
Yep.
What did Alessio Fasano say? All disease begins in the leaky gut. Socrates, that came from Socrates. All
Yep.
disease begins in the gut. So
Yep.
we've known it all along, right? And so if your gut has its own immune system and dysbiosis of the gut is going to throw off your immune system, which will cascade into an autoimmune situation where your body does not recognize self. They see self as non-self and then begins to attack. And with increase of GMO, food, with the
The
rise of
additive.
additives. Not even, we're not even, the gluten is a whole nother topic, but the
Exactly.
fact is that, and infections such as H. pylori or Lyme disease or any of these things that
Yeah.
cause glutathione depletion, which is the master antioxidant. This is a whole setup for an autoimmune cascade, of which
Yeah.
LS or thyroid, such as Hashimoto's, or alopecia, diabetes, etc., Crohn's, all of these guys come marching right
Yeah.
into this autoimmune forum, right?
So when we've got, as a clinician, and you have a patient that comes in, some of my audience, because somebody listening could be a gyne and say, "Yep, I don't evaluate for this often, or I don't know enough about this, or I do need to learn a little bit more about this, or maybe do a little bit more biopsying, or even you don't even have to have a biopsy to confirm it. Sometimes the visual presentation upon exam is clear enough. You can see the changes; they're consistent enough with the pathology, the visual pathology. But what about for a clinician who's not doing any kind of a physical exam? So let's just say like a chiropractor or an acupuncturist or someone, they're not going to examine the tissue. I always recommend that you ask the question, do you have labial itching? Because it's the number one hallmark of lichens. So what other questions could we ask a patient, a female patient, that may help us to flush that out so that we know to go down this rabbit hole of covering this underlying cause and helping them? So, as a pathologist, what would you say? What could we ask? What questions could we ask that would help to flush this out?
Well, certainly itching, burning on urination, dyspareunia, so
Yep.
painful sex,
Yep.
perianal itching also can be a case. If a woman is self-aware and looks and take a hand mirror and take a look, are there
Right.
spots? Do you
Right.
notice white spots? Or is your skin appearing thin? Is it looking thin or white or friable? What LS lesions are described usually as, or paper white lesions.
Mm-hmm.
So
Looks like a little spidery kind of a thing. It's like a little white spider web sort of right on the tissue. It's like the tissue kind
right,
of scars together. We were talking about fibrosis earlier, where it actually kind of pulls together and tightens. And so you lose that architecture, the normal plump architecture of the skin and the
right.
labia. And into menopause, the labial tone is going to reduce anyway. So it is going to reduce. We are going to have less plumpness in that local area, but it should not look friable, tender, like it's going to tear, bleeding upon wiping after urination. Like the skin can get really, really, really paper thin in some
Yeah,
cases.
so asking all of these questions is can be very useful, and most women will know. I mean, obviously
Yeah.
you would know if
Yeah.
this is
Right.
going on,
Right.
but many women do not volunteer this information unless they're asked.
I've
So,
always said it's not lichens, I think, is very under discussed. And she may not even be able to discuss it with her husband because they can't have sex. Intercourse then is painful and she doesn't understand why. It just hurts. And so she doesn't get it. I say it's not lichens is not dinner table conversation. This is not like women sitting across going, gosh, my girl parts itch like crazy. How are yours? I mean, no, nobody does that, right? So it's not something that we just no one talks about it. As women, we just aren't going to naturally talk about it. So I think that as practitioners bringing light to this, and I've been talking about lichens for 20 years, and at the end of the seminars, when I was on the road teaching continuing education seminars, at the end of every seminar, I would talk about lichens. It was like my flag in the sand. I'm like, you guys got to look for this. You have to
that's your
ask about.
soapbox.
It is my soapbox because
It
it's so
is.
underreported and it affects so many people. But I will say this, the youngest child that I ever had with a diagnosed lichens was 6 years.
Yes, that's a very good point because it does appear in children.
Yep. And I had one male and it was on the end of the penis. And he could not have, he had to be very careful even with an erection because the skin would stretch and then it was really painful and it would bleed and he was really uncomfortable. For him, he worked in a cabinet, some kind of a cabinet manufacturing something where they stained and sanded and did cabinet refinishing. And I asked him, I'm thinking, autoimmune, I'm thinking toxic exposure. Like, what is it that's triggering and could have gotten in this immune cause this immune dysregulation? And I said, "Do you ever wear a mask or anything?" And he goes, "Oh, no, no, never have. Have my hands in solvents and chemicals all the time, paint thinner and all the things." And I just thought, okay. And so I asked him, "Is there a way that you can change that up? You can do it differently, wear gloves, wear a mask." He said, "Oh, I'm not going to do any of that." I
You're
said, "Well,
kidding.
oh, okie dokie. Like sex or that, I guess that's your choice. I can't care about it more than you do. I just need you to know this is what I'm suggesting as a starting point." So
Mm.
whether you've got a young child or a man or a menopausal woman, I've even seen it in reproductive age women. It's not as common, way more common in menopausal women. But so now we know, we've got an idea that yes, they're itchy. Yes, they could have lichens. So certainly working with a gynecologist is a good idea. But from a functional standpoint, then, if we are going to go and do any kind of testing, what kinds of testing would you recommend that we do? Because we're thinking in the back of our minds about the gut, right? We're like, okay, this is could likely be autoimmune, and what kind of autoimmune tests, if any, and then where would we go as far as gut remediation? What would your recommendations be?
Well, I love to test. I think it's the best thing ever. I think you can find so much information about a person and the way they live their lives by looking at their gut. So I really love what I do with my clients is that when they come to me complaining of gut symptoms or like such as bloating, constipation, diarrhea, even fogginess, feeling unfocused, people who feel even some sluggishness, depression, emotional things, which all can be wrapped up
Yeah.
into the gut.
Yeah.
When we look and test the gut, I really love using quantitative PCR testing, such as the GI map
Yeah. Such a good
from
test.
Diagnostic Solutions. I think that's a great test, which has so much information because it gives you the amounts of all these bugs and also inflammatory markers such as the IgA.
Yeah.
IgA levels, zonulin. It also gives you the steatocrit. It gives you beta glucuronidase. It allows you to assess digestive function, and you can get a sense of what does their microbiome look like.
Yeah. Yeah.
And you can look to see how much, if there are virulent organisms present. And these virulent organisms can be there like H. pylori, for example. It can just sit there for years.
Yeah.
And even if it is like, they'll give you like a level of what their cutoff level is. And but in my opinion, if a person is feeling symptoms and there is H. pylori present, I do like to treat it. I treat whatever the level is. If it's close, I still treat it
Yeah.
because I find that it's very prevalent, and B, if you treat it, people feel better.
Yeah.
Because what that little bug does is that it interferes with the breakdown of all your proteins that you ingest. Right? Everything you
Right.
bring in, it's going to break everything. It's going to interfere with the breakdown. So when proteins get broken down into amino acids, your body uses those amino acids to build up other proteins that your body needs, like immunoglobulins,
Right.
neurotransmitters,
Right.
hormones, all these kinds of things. Right. And if that H. pylori is interfering with that, those types of things that your body needs are going to be low and
Right.
deficient.
Right.
And that is a setup for autoimmunity,
So
right?
you recommend then doing a stool sample like a GI map test, and there are several
Yeah,
companies out there that do it, but I love the GI
definitely.
map test. So you would do stool testing and then
Yep.
to examine the gut. What about anything specific for autoimmune? Are there any tests that you would have, or you would say, okay, if I had a lichens patient, this is what I would want to look for? Certainly, we mentioned looking at the thyroid, like
I
Hashi's.
would I
Yeah.
would definitely look at the thyroid.
Hmm.
I would look for you can do your TSH antibodies. You can do thyroid function tests, obviously. You can even do harkening back to my days as a pathologist, do thyroid scans, ultrasound scans of the thyroid, where you can see evidence of Hashimoto's thyroiditis,
Yeah.
where the thyroid is shrunken and very nodular looking. You get that Swiss cheese appearance,
Yeah.
and you can even biopsy it and you just see like lymphocytes all over the place, which is basically turning your thyroid gland into a big lymph node.
Correct. That's
Right.
right.
And decreases all the function of the
Yeah.
thyroid. It's taken up because because it's full of lymphocytes.
Right.
Right. So, I mean, looking at the thyroid, obviously look at the pancreas, look and see what the pancreatic function is, see if there any, like, is there any diabetes in the patient's realm, see if there's anything going on there. Look for evidence of other kinds of autoimmune diseases. Primarily really look at the gut and see what's going on there. What's the IgA levels? Is it high? Is it low? Both could be significant for
Right.
inflammatory
Exactly.
evidence, right? Yeah, so that's where I sit with that.
There's always so many different directions to go. And I think that becomes the overwhelming part for many clinicians because they think, oh my gosh, like, okay, so I have this patient, in this case, lichens, but it could be anything. Let's just say it's Hashi's even, but whatever the autoimmune condition is, we know we have to go back at the gut. Sometimes the patients can't afford the test. They just can't afford it, or the insurance won't pay for it. They don't have the right kind of insurance, or the practitioner isn't able to order the right type of test or bill the insurance appropriately. So if they don't have the ability to do that, let's just say we didn't have a test. We didn't have a test, but we can be fairly certain that there is a level of dysbiosis going on at some level, probably some kind of virulent something in there. What would your recommendation be? If you had a patient that just said, look, I just can't, I don't have it. I can't spend that kind of money.
Well, if you wanted to treat empirically, if you can't do that testing and get those hard numbers, I would say you probably have to look at supporting your GI tract, supporting the gut, right?
Yep.
With a good
Yep.
probiotic, a good medical grade probiotic.
Right.
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 Not something you buy like at the CVS that's going to promise something that doesn't deliver. Go for something
Exactly.
that's a decent,
Clinical. Yeah.
a clinical grade
Yeah.
probiotic.
Yeah. Right.
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 So offer your patient that. Offer your patient something to heal their gut.
Yeah.
Supporting the gut. I like Biotics Research Neutrophil Plus, and I like the Bio HPF. It has things like marshmallow and licorice root, and what else did it have? It has all sorts of really good, yummy things to support your neutrophils, to support the gut lining.
Yeah.
The GI Revive I really like.
I like that one. I like that
I
one
like
too.
that. That's Designs for Health. I really like that one. And also going for an anti-inflammatory diet. That's a simple fix.
Huge.
That's no insurance required.
Yeah,
You know,
exactly. You could just start at home. Do this at home today, starting
do
today.
this at
Yeah.
home.
Yeah.
Drink some green tea. Stay away from the processed foods. Stay away from the gluten as much as you can. Stay away from sugar. Obviously, a big one. These are things.
Listen to yourself talking about all this functional stuff. Like, I
Well,
just so love this. Like, you probably
I
would have
love it.
never had this conversation, 10 years ago?
No, I love it too. I love it so much, honestly. And I just launched my website, and I have all this offerings for patients, and I'm like, this is just fantastic that I can do this for people, and it works.
Great. No, I
It
love it.
just works for people, and they feel so much better. They say, oh, I don't have to look for a bathroom every time I go to an amusement park. Things like that it's really very meaningful. So maybe if you don't have to test. I think it's good to have information.
If you can, absolutely. I agree.
If you can, do it. But if you can't, or if there's something that's holding you back from doing that, try some simple things and support them as much as you can.
And
That's what I
sometimes
think.
I think I agree with you. And I think sometimes the patient they may not have value for the test. In other words, the information that it's going to provide to the practitioner. What I will often say is if the patient doesn't or can't afford to test, or you already know you're going to make dietary changes with them, right? You already know you might use bitters to upregulate digestive function. You already know that you may have a sluggish gallbladder. So you're going to use things like globe artichoke or whatever you're going to use, right? So you already know you're going to do that stuff first. Do it. Just get started. Just get started. But what I often will say is if you get backed in a corner, in other words, You've done all the things you know to do. You've modified diet. You've pulled out the inflammatory foods. You've got good fiber in. You've got a good probiotic going. And there's like a 60% improvement, but they're still struggling. That's when I say, okay, and I will have this talk with the patient and say, okay, look, we've done everything we can do. And now I need to know. You're asking me to drive the car and get you to a destination, and I don't have a map. And I need a map. And the GI map test, or the gut, whatever your gut test is you're going to do, that now is my map. Now I don't know where else to go. I've done everything I know to do. Now I need to get deeper information. I need more information in order to drive the car to get me from point A to point B. So I'm pulled off on the side of the road, stopped. We're in a pause until we can get some more diagnostic information. And I think that's also a great time to add a test in. But at that point, the patient has seen the difference and they're like, okay, yeah, let's dig a little deeper and find out what's going on. So
Yeah.
yeah.
Well, you can also, you can motivate people, by showing them that they can improve
Yes.
with
Yeah.
these modifications. Say, well, you know what? We can do even better if you can go there with me.
Yeah. Yeah.
If you let me take you there, we can do better.
Well, this has been the best conversation. I've loved every bit of this, especially the lichens part. It's like dissecting the whole thing. And we could go on and on and on about all the things with the gut. But what I would like to do is I do have a favor to ask you. So before we let everybody know where they can reach out and contact you, I would love it if you would be willing to get on another podcast with me in the future. And we can talk just about and
I
like,
would.
I knew you would love it. I knew
I
it.
knew I would love it.
Oh, yes. So Teresa will bring you back and we'll do another podcast episode and we'll just dive into, maybe we'll just stick with like the GI map test, but we'll just kind of dive into that and look at some of the things, the amazing magical things that you can learn on a GI map test and why that kind of testing would be so, so important to really understand and master. Not that you can't order the test and then call the lab and they'll go over it with you, but really to be able to master that and understand why that is so important as you're leading a wellness practice. You have to be able to have those tools and ability to use the tools and understand them and be able to pull the information out of them appropriately to be able to help the patient. So thank you so much for being on the podcast with me today.
Oh, I am thrilled. And there is so much to talk about with the GI, with gut health. We can definitely have enough material to fill up another podcast for
At least
sure.
I know.
For
So
sure.
how can my listeners get in touch with you?
So intentionalselfct.com is my website. And if people are interested in learning what I have to offer in terms of like cheat sheet for H. pylori diagnosis, treatment, the whole 9 yards,
Love it.
sign up on my email list and I will be sure to get that to you. I am also on Facebook. My Facebook page is Intentional Self and my Instagram is Dr. Terry Alasio, TerryAlasio.
So we can find you both places. So if they didn't get on your mailing list, they could also reach out to you then on your Facebook page or DM or wherever and say, hey, can you send me the H. pylori guide? So thank you for putting that together. That is so nice.
Yeah.
I think it's something that we often overlook. A lot of practitioners overlook the role of H. pylori, but you are right. So many people do have it. And I think that it can be protective and beneficial when it's in a very low level. But the problem is that guy just starts to want to overgrow and take over the world. And so we just have to put that thing back in its place. I don't think we need to eradicate it completely, but get it back down so that it's at its little seedling level where it does provide benefit, but not when it's big and overgrown. And that's what we see on the tests is the big overgrown guy. So
Absolutely.
I love that you put that together. Thank you so much. I didn't know you were going to do that. So that's really thoughtful of you. So again,
Okay.
Teresa, thank you so much. It's been my pleasure to chat with you.
Thanks, Rhonda. It was my pleasure too. Thank you.
Right.
I'll see you next time.
Okay, thanks.